Hi there, this is Jason Clamme, the Engagement Manager for Lower Cape Fear Life Care, coming to you from my house here today, working remotely. But I thought I would take the opportunity to talk with you a little bit about the idea of advanced care planning and the importance that can place in our own healthcare as well as in our families. Maybe answer some of your questions as well as provide a little encouragement to take advantage of this time that we've been given to have some critical conversations with our family and with our loved ones, and to think about what kind of preferences we have, what are our thoughts, what are our decisions. So we're talking about advanced care planning, and there's lots of things to consider when you're thinking about that. I'm not going to be talking today about your legal matters, financial things you can put in place. Really want to hone in and focus on the healthcare decisions that you can go ahead and be making. The importance of this is that it helps you as a future patient, as a person in need of healthcare, to maintain some control of what kinds of things you do get and what kinds of things you don't get as part of your healthcare plan. The importance of this is really beyond that, though, because it also extends to your family, to the people that would be in the situation of having to try to decide decisions for you in the case that you can't. I really look at advanced care planning as being a gift, being something I can give my loved ones so that it would make things easier in those unfortunate circumstances. I often get asked of when is the appropriate time to do this and who should be considering these kinds of questions, and it may sound kind of hokey, but I actually believe that it's for everyone. I speak at many colleges and talk to young people, and I tell them that you're an adult at this point. You have your own thought processes. You have your own ideas of what's important to you, and that's important to share those with people that you know and people that you love, so that if tragically something were to happen, we're not always just talking about disease processes. We also look at accidents and other things that may cause some sort of healthcare crisis. That it's really important for all of us to be having these conversations with our families. There's a saying that it's better to be 10 years too early than one day too late. So that's kind of the mantra that I go with when talking to people about this. So when considering healthcare, what are those things that you can put in place? What are the conversations you can have? So let's focus first on the documents. In North Carolina, as in most states, there are two main documents that we talk about that we look at to express your wishes. The first is the living will. Many of you have heard about the living will. Many of you remember cases such as the Terry Schiavo case in our history, where families were torn apart, where even all the way through our media and our medical community and our politicians all got involved on this very difficult question of when is enough enough. And so if you or your loved ones have certain thought processes on that, if you are deemed terminal and incurable and life prolonging measures are needed to keep you alive, is that what you prefer? Is that what you want? And if you want to use a living will to express those choices, that is important. The other document I think is as important, if not more important, and that is your healthcare power of attorney. This is a form that you put in place to designate an individual, a living, breathing person, to take in the information, to process what they think are the best options, weigh that against what they know about you and your preferences and your decisions and your choices, and make decisions for you. Be your voice, be your advocate. This is, to me, like I said, an important piece of this planning process, because when you have a person as your agent, as your proxy, you have the most ability to drive those decisions. There are other documents as well. You think about the DNR, the Do Not Resuscitate Order. In North Carolina, we have the most document. It's a medical order for scope of treatment. But those are medical orders. If you're interested in those kinds of planning processes and those forms, I encourage you to speak with your physician about those. When thinking about and deciding and having these conversations with your healthcare power of attorney, it can be sometimes challenging to decide who that person should be. It's going to be different for everybody. Every family, every relationship is unique. A few things I do encourage people to consider, though. One is that they are sure that this person is willing to do it, that they are accepting of that responsibility. I think one of the challenges or one of the negatives of the healthcare power of attorney form is that you can actually, fill it out, put a person's name down, notarize it, have it legal, and the person never agreed to it and actually never be aware that they are the one listed on that document. So I really do encourage having those conversations ahead of time. Unfortunately, there may be cases where your healthcare power of attorney doesn't want that responsibility, that they don't feel capable, they don't feel able, they don't want the pressure of making those really tough decisions. So having those conversations beforehand are vitally important. And then I would also consider the decision-making capability of the person you're choosing. Do you trust them to like I said, process the information, to maybe stand up against other opinions that might think otherwise in order to advocate for your choices? There will be no lack of information, healthcare options, opinions from family and loved ones, social media, pop culture. All those things are going to play into the decision-making process. So picking someone who can filter through all of that and make sound decisions that you feel you would be okay with and trust, that's vitally important. So as we get started with this, and I know I'm throwing a lot at you very quickly, is that to take it slow. Take baby steps. This is not something that it necessarily has to be a one and done. A lot of people look at it like a New Year's resolution. I've done my advanced care planning, check. I'm done with it. It is a process. It's something that evolves through time. Talk about some of the easier questions first. I like to have people start off with things like bucket lists. What are your, what do you want to still have happen in your life, even now while you're younger and you're healthy, and what do you want to see occur in the future? Maybe talk about life stories and legacy planning and words of wisdom and things you want to make sure that if you weren't here tomorrow, that your kids, your grandkids, those sorts of people remember about you and about your past and about your family. And then move into some of the more serious questions. A lot of planning can also be about what happens after your death. Are you in favor of cremation or burial? Are you looking at planning your funeral or your memorial service? Organ donation, pet care, all these kinds of things can be part of this conversation that you're having before that crisis. I also encourage people to consider examples in their own lives. What other family members have gone through these in the past, and what did you agree with and what did you not agree with? You could even use scenes from a television show or episodes or scenes from a movie or a television show to kind of kick that off and have that discussion in a less threatening way because it's happening to people on screen. Or I've heard a lot from parents that their kids are not interested in having these conversations. Well, I wouldn't let that necessarily keep you from still doing that planning. Putting down on paper what is important to you, and then maybe just kind of little by little sharing that with them as you go. Who knows? It may end up encouraging them to do that, to do the same thing. So that's kind of the information I have for you today. What should you do from here? We are certainly here for you if you have any questions. We are a phone call away, Lower Cape Fear Life Care. You can shoot me, Jason Clamme, an email. and I'm more than happy to answer your questions. We also have a lot of resources online. So if you go to begintheconversation.org or lifecare.org, you will find lots of things related to different disease processes. We actually can download the forms for you to look at. We have access to links to other types of information that might help you kind of start your research and honing in on the decisions and the kinds of things you want to make. So, well, this is, I've enjoyed being here with you today. Thank you for the time. I do wish everyone out there to be safe and enjoy this opportunity to begin the conversation. Thank you.